In 2010, I was diagnosed with prostate cancer. And for the life of me, I could never imagine going out and being an advocate for prostate cancer. And then I got a nudge from my wife to go to a walk-run race. And there, I met so many people from the prostate cancer community, I decided it was time for me to lend my voice to the cause.
So I'm here today as a caregiver for my husband who was diagnosed at 39 years old with bilateral multifocal kidney cancer. And our initial treatment recommendation was to remove both of his kidneys and to put him on dialysis. Thanks to a patient advocacy group, I was able to get him a second opinion. And that second opinion explained his rare subtype to us and also gave us the option to keep his kidneys, remove the tumors. And so that's what we did. So over the last 4 years, he's had 4 partial nephrectomies, removing 55 tumors with no loss of kidney function.
I was born with bladder exstrophy, and bladder exstrophy is a rare condition, very rare, 1 in 50,000 births. I think like most kids with bladder exstrophy, there were some embarrassing moments. It wasn't always easy, and we didn't talk about it. We didn't tell my friends didn't know about it, and I didn't know a single bladder exstrophy patient until 2 years ago, actually.
I'm here as a part of the patient perspective and giving that talk, and I think they're doing a great job of listening, and that's what men want. They want somebody to listen to them. They don't just want to be another number or another patient. And I think the AUA is really making great strides to get that message out there in the communities. I know it's working in my area back in Baltimore, Maryland, and I know they're doing it across the country. So I would say, keep doing what you're doing.
What I really would like the urologists to understand is our patient community is very diverse, and that we as a council, adult patient council of a urological condition that we've lived with our whole life, we could be a resource to urologists. And we're hoping to be able to have focus groups and more content that we can provide and also be a research opportunity for them.
I would say to the urologists here at AUA2025, first, thank you for everything that you're doing to advance kidney cancer diagnosis and treatment, but also to please consider renal preservation, because there are cases when the risk of renal function outweighs the risk of metastatic disease. And patients, even when that is the case, and even when studies show that, patients are scared. They are scared, and so living with active surveillance is really challenging, and patients often choose surgery when it really isn't the best option for them. So I think if urologists can have those kind of conversations and try to minimize the alarmist messages that patients feel and the alarmist thoughts that they feel when they're diagnosed with cancer, I think that we can try to save more kidneys and also treat kidney cancer.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.